We are recording.
We're recording. Hi, Claire.
Hi, Isabelle.
All right, it's great to be here.
Yep, pretty exciting to be starting with this podcast.
It
Um,
is.
yeah. So today we're going to be talking about supervision. What is supervision? What it looks like, what good supervision looks like, what not such good supervision looks like, and what you can expect, and maybe a few tips about what, I guess, how you can use supervision and how you can make the best use of your time. We all know that supervision is expensive. But you have to do it. And so let's really make it count.
Sounds good. So, we're going to first cover this question of what is supervision? What is it in the context of being a therapist or an emerging psychologist?
Such a good question, because I think a lot of people, they go into supervision quite blindly. We're told we need to do it, and we turn up for it, but we don't necessarily understand exactly its purpose and what it's for. So hopefully today we can sort of unpack some of that for you.
Most definitely. From the psychologist's perspective, you and I have both been through that very intense 2 or sometimes longer years of supervision. And so when we're talking about supervision today, what we are really outlining is this mandatory process that we all go through to check that we are meeting competencies to become a professional and ethically trained person in this role. Would you agree?
Absolutely. And even beyond the internship as well, we still need to maintain those competencies. And so getting support with supervision or peer consultation, as it's sometimes called, I see that as really a lifelong process for as long as we are in this career.
Mm.
Something that I think is so important that we engage in, which is why we need to I think really make it count and access supervision that works for us.
Yes, I agree. Well, some of the nuts and bolts that you and I have kind of outlined around what is supervision are that it is that quality assurance process, especially in the field of psychology. So we're wanting to really hone the developing therapist skills and reflective capabilities in their role. Uh,
Yeah, absolutely. And also supervision can, I think, change certainly over the course of our career, sort of the lifespan of our career as therapists. And at the beginning of the internship, it might look a little different towards the end of your internship and also once you're fully registered. So I think that's
mm,
all supervision can look very, very different to different people.
mm. And different types of therapists too, right?
Absolutely. I think your style will be really influenced by your supervisor's approach and style. I certainly know that my approach to supervision is very much mirrors, well, I hope it mirrors the supervision that I've really benefited from over the years.
And
Um,
what's some examples of that? I'd love to hear that.
Yeah, so I had an amazing supervisor for a number of years, and actually before I was referred to her by somebody who, I can't remember the exact way he said it, but he said, imagine that you're small and that she's big, and you're going to be like her when you're big. And at the time I thought, wow, I'd love to be like her. But I think that I've really tried to mirror what she provided me. And for me, that was a real balance between theory and practice, but also some really practical steps. So I would leave supervision with a clear sense of what I could
Mm,
do, not just what
mm,
I could think about and what I could read, but
mm,
actually what I could actually do. And so that clear action plan for me, how to tackle something in the next session or where I was going to go with something, it felt quite tangible. And so I really try and provide some of that to my supervisees.
mm. I love hearing you say that, Claire. I think I can relate to that experience. I had some wonderful supervision when I was developing my skills as a psychologist. And it's part of what influenced me to want to become a psychologist early on in my career. A supervisor early on in my career. Psychologist as well. I just remember thinking, wow, I was so nervous and so anxious, and I had no idea what I was doing. But every time I went to supervision, I came away with these nuggets of gold. And it shaped me and molded me, and also gave me confidence, like a reassurance that, no, Isabelle, you're doing okay. It's normal to feel unsure, imposter syndrome. But here's some steps for you to take to help you bridge the gap that you're experiencing at the moment.
Oh, I just love that. You mentioned imposter syndrome and you mentioned being nervous, because of course that is mostly the case for anybody new entering supervision. It's quite terrifying. Walking into somebody's room, or more recently, even in an online setting, but in really sharing those things that you don't yet know and need to know, and that balance between, how much do I show what I can do and what I do know, versus how am I going to get the support I need. So I think that we all come into this with imposter syndrome. And so for any new therapists listening to this, this is actually a really normal way to feel when we first start out. And actually, to some extent, I still feel nervous when I go to supervision, or I still feel like, am I just giving away this balance, or presenting this balance of, do I know enough here, versus what do I need to get here? Can I ask these hard questions? Should I know this stuff? And over the years, I've learned to sort of let some of that go, because ultimately I'm going because I need it. And I think, well, how can I get the most out of this? And so that's what I try and encourage anybody to do, is sort of go in with that sort of, the biggest question you're going to come into the supervision is, what do I need from this, and how can I ask for that? So I really love that you brought that up.
Yes. And
Yeah.
I think we can all relate. Anyone who's just, starting out, maybe, who's in uni thinking about going on to one of the programs to become a psychologist, or if you're a social worker looking at doing a master's in counseling, something like that, we're all going to feel so nervous and so unsure and out of our comfort zone. And I love that you said that, feeling out of our comfort zone and feeling like we don't know everything, that for me is an indication that we're doing really good reflective practice throughout the rest of our career. That feeling of, oh my gosh, there's still so much for me to learn, even if you've been practicing for 20 years. We will never know everything.
No, I can guarantee that. And you'll always need, I think you'll always need supervision, and I think you'll always need, it may look different as you progress, but I think we always need support. And like you said, we're never going to know it all, ever.
I love that.
Except now.
So we kind of touched on a few things here, haven't we, around what to expect from supervision, normalizing the feelings and the experiences that we have, especially when we're new to supervision and new to becoming a therapist. But we're also sort of touching on the qualities of good supervision here a little bit, don't you think?
Absolutely.
What are the signs that we know we're benefiting from this, right?
Yeah. How do you come out of a session? Because I think you described these nuggets of gold, coming out of that session with those nuggets of gold. That would indicate that was a pretty good session, and that you come out with what you needed. Yeah.
Can you think of other things that from your experience as a supervisor and as a supervisee, things that would tell other people listening today that they have a good supervisor, or they're having a good supervision experience?
Oh, there's so many things. But I think that, being confidence is such a big issue. And, as we've just talked about, and I think if we come into a session with doubts about something, I think it's so important that supervision really focuses both on the strengths and what you're actually bringing to the work, because there's so much good stuff. And yes, we want to celebrate our wins, and sometimes it's really important to spend time in supervision really focusing on those wins, but ultimately we are there to learn as well. And so having that balance of, knowing what you are doing well. You've got this session that may not have gone as planned, coming away knowing actually some of that, I did really well, but these are things I maybe could look at doing differently. And I think that, being, I guess, feeling more sure of ourselves and our own processes and what we bring to this. Sometimes a session doesn't go so well, but thinking, what, I did the best I could there, or actually there are other factors at play, whether or not I'm out of my depth because it's beyond my scope of practice, and any other number of reasons why sessions go well, sessions don't go so well. So I think that being able to come away with a sense of what we do well versus a sense of, okay, these are the gaps, I think is really important. And I think to come away from supervision feeling like your supervisor sees you, and sees those, sees where you're at and can detect what you need. That would be one really primary thing.
So that supervisor you're kind of describing is someone who's interested and connected and present with you in supervision. They are also not going to be inappropriately critical if you do, or you're going to feel safe enough to bring an example case to supervision that you want to share because it didn't go so well, and that you're comfortable enough to review that with that supervisor, knowing that then you're not going to get an inappropriately negative response.
Absolutely, because that in the same way that we want our clients to feel safe with us, I want my supervisees to feel safe enough to say, you know what, this seems like a silly question, but can I ask it anyway? And I'm like, there are no silly questions because it's all learning. And if we don't ask those questions, that, we can easily miss things. So yes. And we all have, different blind spots and different strengths. And so, yeah, absolutely. I would want my supervisees ideally to feel seen, and I can sort of navigate what their needs would be through the relationship and through I guess the previous sessions that we've had, because we're going to build.
You reminded me of a couple of things as I'm listening to you talk, Claire. A thought popped in my mind to have a little discussion around confidentiality in the supervisee-supervisor relationship, because that's something that maybe people who are studying psychology or wanting to become therapists, they're listening to this podcast today. How much of my private information or my private practice information is kept confidential when I go into that supervision space?
Oh gosh, so important. The supervisory relationship is a contracted relationship. It's not the same as a therapeutic relationship because the dynamic is a little different. For example, as a supervisor, and I'll be interested in your perspective on this, but I would probably disclose a little bit more than I would in a therapy session, because I want the client to see how I work, and how I might respond, and also maybe some of my blind spots, because that's going to hopefully normalize some of that for them. But there is a code of ethics, and there's a code of ethics, but there are also ethical guidelines specifically for supervision, and these are published by the Australian Psychological Society. And I share those with new supervisees because they can expect from me. There are certain things they can expect from me, and I think it's important that they know that I am actually bound and contracted by that code of ethics, and so that they can expect a professional service, they can expect confidentiality, they can expect that I'm going to uphold my share of the tasks required with a internship. Particularly, there are tasks that the supervisor, for example, some of the reports, supervisors need to complete those reports, not the provisional psychologist. There are certain components that do need to be completed by the provisional psych, but the supervisor needs to be completing their component, and they need to be signing off on certain documents. And I think that for provisional psychs particularly, it's really important that that is understood, exactly what our role is and what the requirements are, but also that if there are concerns, that these be addressed in the same way that it would be in a therapeutic relationship. So if a supervisee has a concern about their supervisor, ideally they would go to the supervisor and discuss those concerns first, but that actually that we do need to adhere to that code, and that anything outside of that is actually reportable in the same way that unethical behaviour would be reported. And so confidentiality, I've gone a bit beyond confidentiality there, but confidentiality sort of falls within that code of ethics. So what you say to your supervisor stays with you and your supervisor.
And it's only broken if there is a serious concern about that person's practice. Absolutely. Or a serious concern about their ability to perform their role for other reasons.
Yeah. Or if there's a concern about a client, those confidentiality, the client therapist confidentiality and code of ethics come into play, because if there are concerns around risk of harm to self or others, then of course the supervisor is going to support the client with that information. And so,
we carry that risk with them.
Absolutely. Absolutely. I mean, I sometimes say to provisional psychologists, I feel like sometimes we are doing this together. Like when a case report gets approved, for example, through AHPRA, I sort of think, well, we've passed, because ultimately I've had to, it's their work. It's not my work at all. I won't take credit for that. But I have to sign off on that. And if I'd signed off on something that doesn't get approved, then I'm going to hold myself responsible for that, and see that I need to brush up on something there, because it's my role to ensure that whatever goes to AHPRA is at the required standard.
I completely agree with you there. Every approved case report or every successful exam completed, I think, yes, I get to share in that joy that supervisee is experiencing. But absolutely, if there's a failure, or if they're, sorry, that's a terrible word, but if someone doesn't pass an exam, or, doesn't pass a case report, yeah, most definitely, straight away I'm thinking, okay, what could have I done differently? Where did I go wrong there? We share this responsibility for our clients, but also for the achievement of the competencies as you become a psychologist in particular.
Yeah, absolutely. Absolutely. Because at the end of the day, we need to sign off as supervisors. We need to sign off on that paperwork to say this competency has been met. And so, in some ways I'm quite, I don't know, strict is the right word, but, I'm quite clear about some of the requirements that I have from an ethical and legal nature, because my signature needs to go on that form. So, it is an ethical responsibility that we really hold. And if there was to be a complaint about a provisional psychologist, the supervisor's notes would be subpoenaed, most likely, or requested if not subpoenaed. And we would, we would probably share in some kind of notification or investigation. So
it's a serious responsibility that we have.
Yeah, it absolutely is.
And we want to share that with our supervisees. We want them to, I guess, learn to sort of navigate and be comfortable with having that responsibility on their shoulders as that professional person. So that when, you know, at least if we finish the first couple of years of those mandatory supervision years, that they do emerge. I love that description you use, you know, as feeling as though they have grown in their depth and breadth, but also their confidence and their comfort in being a person that has that responsibility from the guidance that they've received and the nurturing that they've received from us.
Absolutely. And you know, it sounds scary when we actually, you know, when we think about the weight of that responsibility. And, you know, but ultimately, if we follow that code, then, you know, we can be assured that we're doing the right thing. And it's quite clear what we need to do.
On that note, I have something I want to share. I developed this idea when I was still, I guess, receiving supervision as I was becoming a registrar as a clinical psych, and discussion in a multidisciplinary team, talking about code of ethics and things like that. And I could sense anxiety in the room. I could just sense that there was this anxiety that, you know, one wrong step, and that's it, you struck off. And I remember thinking to myself, if I ever do something that bad, you know, really, really bad, that a report's made and I'm not able to practice anymore, I will accept that, because that means I haven't performed to the level of the professional ability that I should be performing. And I'm just, and then as soon as I thought that, I didn't feel anxious anymore, because I kind of just, I accepted that I have this responsibility. I know the code of ethics and I follow it. And if I really stuff up that badly, man, I don't deserve to be a psychologist. And that let me go on my way after that.
I love that. I love that, because we will make mistakes. You know, we will all make mistakes, and we will all do things that we maybe regret or that we need to fix up later. But like you say, if, you know, if we do something really terrible, you know, then a notification is going to, you know, be warranted. At the same time, I have sometimes heard of some complaints that have been made that haven't really been warranted, and it's a very, very stressful process. But I mean, when I have worked with people around this, you know, we've always looked at, okay, well, what have we done right here? You know, and what have we followed? And look at our you know, like just following the process that we've taken. And, you know, in these cases, particularly the cases that I've worked with, you know, they've usually been through a process and through an investigation and come through the other side, and all has been well, because of course, breach that you're describing. So yeah, I think it is so important. Yes, we hold it, but in some ways, I think sort of just to hold it, knowing that we know what we're navigating here.
Wise words. Hopefully those listening are feeling somewhat reassured, but also helping anyone who's learning to become a psychologist or therapist now to get a rich understanding of this experience of what it's like to be navigating these early career years and the supervision that you'll be getting. And I know sometimes we want to sort of also explore what is not so great supervision, because sometimes we don't have much choice in who our supervisor is. You know, if we're put into placements through our university, or if there's just a limited availability of supervisors where you are, we can feel, thinking about myself as a supervisee, sometimes we can feel like we don't have much choice, even if we are experiencing a supervision relationship that's not feeling like it's useful or helpful, or maybe even destructive. So I wonder if maybe we can finish today's recording talking about maybe some of the things to consider. What can you do? What's within our, what can we do if we notice that when in a supervisory arrangement that's not meeting our needs?
It's really difficult to be in that situation when we have a supervisor that's not necessarily a supervisor of our choice. I mean, my recommendation is always to think about how you can make the best of the time that you have with somebody. and to think about really coming back to what your supervision needs are. And they can be so different. I mean, I think every session, every supervision session, in the same way that every therapy session is usually very different, because the needs that the person brings are going to be very, very different. So really just thinking about, what are the needs at the particular time of the internship? Sometimes it really is, I need to tick off these competencies. I've got a set number of tasks that I need to complete, and
I need to record a certain number of hours on this placement.
Absolutely. Yeah. What are those things that are the primary importance? What needs to be, what's going to get you to your end goal? And then thinking about how we can get that from the supervision. Having that conversation with your supervisor around, well, this is what I need to be meeting, and how can you support me to do this? I think when supervisees are more sort of self-directed and self-driven, they do tend to get a little bit more out of supervision. When someone comes to me and says, this is what I want from the session, I'm like, okay, well, I know that you've got 3 or 4 things here, and I'm keeping that in the back of my mind, so that as we progress, and even if we digress, which is quite easy to do, we can come back to what their needs are.
Having that agenda at the beginning of the supervision session, so great for helping both the supervisor and the supervisee to keep on track.
Absolutely. And I think the supervisee ideally would set that agenda, because they are the one that they know what they need in their practice. Is it that I've had 2 clients this week that I need support with? So that comes up first. I think when the supervisor sets the agenda, which I might do later on towards the internship, because like, you've got 3 case reports to write, and we've got these competencies to tick off, and we've got a report due next week, and we need some observations. I might sort of just put that reminder, and then the client says, but the supervisor says, I've got a client I really, really need to speak to you about. That normally comes first for me, because as a supervisor, that's the work. That's the day-to-day work I think the person needs support with.
The focus on the clinical comes first. Yes.
As a supervisor, I would always place the focus on the clinical first. But when I see that that's then overriding all of those other factors, that's when I might start to become a little bit more directive. But coming back to that question around, well, how can the supervisee access the support that they need? If they're not, I mean, ideally they'd have that conversation with the supervisor around what those needs are, and set that kind of agenda, because I think any supervisor is going to appreciate that, knowing what you're needing to achieve in the internship. Sometimes the organisational factors come into play, and then accessing support outside of the internship might also be helpful. Even like accessing group supervision, because if you've got a primary supervisor in the workplace and that's covered financially, group supervision is probably more cost effective to access. Also establishing peer support groups around maybe speaking to other supervisees around what their experiences are.
I can relate to what we're talking about from my own experience. And I remember having an experience where I was like, oh, I'm not sure how to address this with my supervisor. So that's when I reached out. I reached out to peers who I was working with, and other senior clinicians. What would your suggestion be that I do in this situation? And that helped me again to bridge that gap of how to have those tricky conversations, or those uncomfortable conversations.
Yeah, it's difficult. I mean, I had a supervisor in the workplace for the 2 years of my internship. So throughout my whole internship, I had the same supervisor, and it was my employer. And so
you had a dual relationship.
Absolutely. I had a dual relationship. My supervisor was amazing at getting me through the internship, but a lot of the organisational elements had to be met through supervision. And I found myself utilising supervision beyond the internship in a very different way, because I was then able to take exactly what I wanted to supervision. And this is what I mean about being an ongoing relationship, sometimes for the internship, as long as you're getting the internship needs met. Now, if the supervisor's not meeting the internship needs, I think that's the different story, and really around potentially then accessing a secondary supervisor whereby you can, and even if you're having to fund that yourself, whereby you can begin to get a sense of whether or not this really is meeting your needs. Because if the supervisory relationship isn't meeting your needs, you can change to a different supervisor, but it's harder when you're in the workplace with that.
There's so many considerations here. I think I like what you said about having a secondary supervisor. I've always encouraged anyone I work with as a supervisor, supervisee, to think about having more than one supervisor, or even changing supervisor if that's an option. I'm more than happy for someone to say, if I'm doing a 4+2 with them, Isabelle, I'm moving workplace, they've got a supervisor that they can provide me. And I always say to them, please don't feel obligated to stay with me, because I'm only able to teach you and share you with my breadth of skills and knowledge. When you go in and you find another supervisor to continue your program, you're going to get all of their knowledge, all of their skills and that experience with them. And I feel like that can add to your clinician's ability when you finish off whatever program it is that you're on. It just enriches you.
Absolutely. Absolutely. I'm exactly the same. I mean, if somebody, particularly as an external supervisor, where they're paying to see me, if somebody's offered a job and it involves supervision, I'm like, take it, take it. And I'm here if you need me as a secondary. I mean, I'm happy to be involved or not be involved. But I always go with the intern's needs, as opposed to, there are plenty of people looking for supervision, and I'm wanting people to support people to access what they're needing. And if I can provide that, then I want to provide it. But if I'm not the person to provide that, or if my style of therapy or my style of supervision is not what somebody's needing, then absolutely. I think, I wouldn't take it personally if somebody wanted to move on, and I would encourage anybody who is listening and thinking about moving on to a new supervisor. It's your experience, it's your supervision, and you have the right to see who you want to see. At the same time, if your supervisor is not meeting your needs, then sometimes being brave and having that conversation can also shift things in a different direction. Because if we don't know, and I've had conversations with people before and they've said, I need a bit more of this. And I've said, well, I'm so glad you told me, because now I can do more of that. So I think that, as a supervisor, we, in the same way as we are as therapists, we ideally will be open to, exploring the needs of the people that we're serving. And so
flexibility and not taking things personally.
No. I mean, of course we want to be able to provide that good service, but sometimes it's the style that doesn't work. And also we have to, I think that it's important to be open to feedback as well. If what I'm providing is not of value, I actually really want to know that, so that I can provide something of value.
I love that. Yes, it's something that I try and do after, when I'm working with 4+2, every 6 months when we're doing the review back to the board, I'll also sit down and say, okay, it's your time to let me know how I'm going now. It can be an awkward situation, so I provide a couple of different options for how that feedback can be provided. But I do have a couple of particular questions that I like to just check and make sure that the person is feeling like I'm meeting their needs and that they're comfortable.
I love that. Yeah, that's it's because that mutual feedback. I mean, often you kind of get that as you're going along anyway, but sometimes when you don't, that can be really
sometimes helpful. It's just good to do anyway, because sometimes, I did some feedback informed therapy training recently as part of my job, and some data was presented to us from some meta-analysis of research on the client experience of their therapists, and some of the perceptions that therapists had of how well things were doing compared to the actual reported data from clients, we're not very good, it turns out, at perceiving whether or not things are going well and we're doing a good job for our clients. And so I could imagine that could transfer into the supervisory role relationship as well.
I imagine it could, because we sort of, particularly, and I forget about this sometimes as a supervisor, but there is that sort of sometimes that power difference. I don't like the word power, but it is that sense of, in the same way as in therapy, there's a sense of seniority perhaps, and that can sometimes make it difficult for somebody coming into the profession, who's accessing the service, to feel comfortable enough to speak up. And that's something I think that we do begin to develop as we get older, and that too, as we get more experienced. I think also we often need it more in those early days. Because accessing that support, the internship can be pretty tough. And so having a supervisor, I would just sort of think, does your supervisor, do you feel like your supervisor's got your back? Do you feel like your supervisor believes in you? Do you feel like your supervisor is meeting your needs and giving you what you need?
Are you noticing that you're growing? If you compare yourself to when you first started out and the 6-month review comes and you think back to how you were in the beginning to what you're doing now, is there growth there? Because if, maybe that's not all up to the supervisor, that is up to you as well. But yeah, if there has been growth and you're feeling, that confidence is growing, your capabilities are growing, it's a good sign.
Yes, absolutely. And that's what we're hoping for, which is why it does change throughout the internship. Absolutely. So, yeah, I think it's really important that, you, in reflecting, and I would hope that anyone listening would be reflecting on their own supervision experience and just determining whether or not it's giving them what they're needing to complete the internship, but also, or within the work, if you progress beyond the internship, or registrar program, or whatever pathway is being followed, but also that you're developing that confidence, not only ticking off those skills, because we can always do another training and another webinar and, some learn more and read another book, but, are we actually using that to develop confidence, and beginning to feel sort of that level of comfort in ourselves, and our own identity as therapists.
Oh, and talking about identity as a therapist, we're not going to go there today, but that is a topic that has been coming up for me a little bit in supervision, and I think that could be something very cool that we could cover down the track, which I'm sure we will get to.
Absolutely. Yes, I'm sure there's lots we could say on that.
Yes. All right. Well, it's been so good to share our ideas and our thoughts with our listeners today on what supervision is and what you can expect, and hopefully reflect on some of your own experiences, and hopefully continue in that journey of becoming a therapist in a really supportive and helpful way.
Yes, hopefully what you've taken away today has been helpful, or at least some of it's been helpful. And please also let us know if there are any other topics that you'd like us to cover, because we've got a number of ideas and lots of ideas and some topics that we'll be covering over the coming weeks. But if there's anything that comes to mind for you that you'd like us to discuss, then please just drop us a line, and we'll be happy to include it on that list of ours. Thank you for listening.
Great. Okay, see you later, Claire.
See you later.